I'm Dr. Kaczynski, and this is Plastic Surgery One-on-One, your internet source for answering plastic surgery questions. Today we're going to talk about a question that I get all the time about facelifts, and it's said in a variety of ways, but the basic question is it time? Am I ready for a facelift? And I get this asked by patients from age 40 to 70. And there's a short answer, and then there's a more detailed answer. The short answer is it's time when you look in the mirror and you don't like what you see. It's time when you look in the mirror and you don't recognize who that person is. That's the time when you need to do something. Is it necessarily a facelift? Well, it depends on the anatomy. As you know, if you've followed my blogs, I talk a lot about anatomy. The surgery that we do is based on the anatomy that we see. And for facelifts, there are three things that we look at. One of them is the nasolabial fold, the other one is the jowl, and the third one is the neck. So if you're looking at a face, the nasolabial folds are these folds here. Everybody has them, even teenagers, but as they get more pronounced, they get more saggy, they droop more, they become less acceptable. The other area that we look at is the jowl. A normal face, a young face, is rather oval, sometimes it can be heart-shaped, but it has smooth curves. When it starts becoming square and you start having sagging along your jawline or jowling, that's also time to think about doing something. The third area is the neck. When you start seeing bands or extra skin in the neck, it's time to do something about the neck. So those are the three areas that we pay attention to: the nasolabial fold, the jowl, and the neck. So if you or someone has all three that are a concern, the nasolabial fold, the jowl, which is this little collection of fat on your jawline, or excess skin or fat in the neck, that person is a candidate for a facelift. But what happens if you don't have all three? What can you do if you're just starting to see aging changes and you don't like them, but you don't have the nasolabial fold, the jowl, and the neck? What can you do? If it's only the nasolabial fold, fillers can be used. Fillers are injectables, which can be compounds like Juvederm, Restylane, Radius, or fat. I've used all of those fillers, and they work nicely to fill out the nasolabial fold. This is usually one of the first things you see in a younger person. Younger meaning mid-30s to mid-40s. Jowls. If someone has some starting jowls that are affecting the angle of the jaw and not much else is going on. Well, what I've done for many years is something called microliposuction. With little teeny incisions and very tiny blunt needles, we can actually do microliposuction and take the fat out of that area and shrink it up. This works very well, again, for people in their 30s, even up into their early 50s, if it's an isolated area. How about the neck? Same thing. Liposuction works in the neck area for people from their 20s up until some point in their late 40s to early 50s, because liposuction causes the skin to shrink. If there's more going on, we can do a neck lift, again, in younger people. If someone is older, which is to say somewhere in the mid-50s on, usually the skin does not shrink up well enough from isolated liposuction. And then we do have to do some sort of lifting procedure. So there are a lot of options that are available, but the basic thing to remember is you have to look at three things: nasolabial fold, jowl, and neck, and evaluate what is going on with those. Depending on what's going on with each part of the face, either smaller things can be done or the entire area can be treated. This brings us to the end of our tutorial. I'm Dr. Andrew Kaczynski of Advanced Concepts in Plastic Surgery, where art, science, and beauty come together for you. For more information, please come to our website, drkmd.com. Thank you.